Okay, so we're here with Salinas, a doctor, and we're gonna interview you today. And thank you for taking this interview with us. The first question is what causes the disease, diabetes? What causes diabetes?
It's a problem in the pancreas, where the pancreas do not secrete the exact amount of insulin to lower the levels of sugar in blood.
Okay. How serious is diabetes and how does it affect the patient's current lifestyle?
It's very serious if you don't take care or don't take your treatment. It could give you to death. You could die of diabetes if you don't treat it. But if you treat it well and change your habits and your alimentation and do exercise, you have very good prognosis.
Okay. What is the patient's prognosis?
It's very good if you take care, if you go to your endocrinologist and your doctor and nutritionist and take a good diet, make exercise, take your medicines every 3 or 4 months, take your blood levels, your sugar levels on your blood, and if you have good control, it's very good prognosis.
Okay. Lastly, from me, what was the patient's chief complaint? Why did they come to see you? Why would they see you if they have diabetes?
Some of the patients lose weight without doing a diet. They can lose 10 kilograms without doing anything. Have a lot of thirsty, take a lot of water, and go to the bathroom every half an hour.
Okay. And what symptoms does the patient have?
The first symptoms is lose weight, thirsty. They are always thirsty. They cannot satisfy the thirsty and go to bathroom. And some of the patients, the children, is more often that to have an abrupt initial start of the disease with going to emergency room with a very altered exams and very high levels of sugar. Probably an adult will have 200, 300 milligrams in the blood, but children can go to emergency room with 600, 500, and it's very dangerous.
Okay, thank you.
How is a patient tested for the disease and what do those tests reveal?
The patient was tested with blood levels, sugar blood levels. You can make it a simple test just on the finger that you can screen a lot of people. You can screen 100 people with a finger, just a little drop of blood. But when you suspect that he has diabetes or the patient has diabetes, you should make blood levels in a laboratory is more exact. You have in laboratory like 3 kinds of different exams.
Okay, so what were the patient's treatment options?
The first option, the more common for diabetes type 2 for adults is the oral tablets with a different, you can have metformin, Januvia, different things. For diabetes type 1, you have to make injections of insulin. And for children, all of them have insulin, their injections every day.
Okay, what treatment did the patient receive and how effective was it?
For the children, injections of insulin is very effective, but you should take levels of sugar blood levels during the day, because if you inject more insulin and he skips meals or it's hungry, the blood levels can go very low. It is not safe or healthy. And for adults, it's more common that you have treatment like tablets that you take, and it's more safe, more easy that treatment.
Okay. What would happen if the patient didn't receive treatment?
It will have different disease in all the body. He can have in the eye retinopathy, diabetic retinopathy. It can have kidney disease, leg disease. They can ampute a finger, a toe, a leg. because the circulation of the vascular system is going to be damaged.
Okay. And finally, what new technologies now exist for preventing, diagnosis, or treating this disease?
New technologies for children is like a little aparato. How do you say? Like something that go inside the skin, over inside the skin, and it liberates the exact amount that the children needs for insulin. When it detects that little chip detects if the levels of blood sugar is too high, it liberates more insulin. If the sugar levels are normal, it does not liberate. That's the most modern, but the newest thing. But we still use things that used years before, that it's take sugar blood levels in the laboratory and take orally some pills, different pills. We now have pills that lower your sugar levels and also helps to regenerate some cells in the pancreas. That's a new one on the tablets.
Okay, so thank you very much.
You're welcome.